So hello, I am so excited to see all of these wonderful people in a room together. So I know that we've done our best over the last few years to do things virtually, and we have done as well as we could on a virtual platform of creating the community that we need to treat and to work with all of our bleeding disorders patients across the country. But it's so wonderful to see everyone in the same room together, and we had an interdisciplinary group meeting this morning, and the one thing we all agreed upon is that while the virtual platforms were so important during the pandemic, now that we are maybe past pandemic or past the main part of it, it's so important for us to rebuild some of our communities and be able to see people person to person and build those communities again. So making sure that we're integrating some of the new people in the team, making sure that we're integrating as a community again, because I think that's one of the things that makes the Canadian Bleeding Disorders group great. It's that working together and that we know each other. And because we know each other, we're able to do great things for our communities and for our patients. So I'm so excited to see everyone in the same room together. Thank you so much to CHS for making today possible. Thank you to all of you guys for being here. And I think we're going to have an absolutely wonderful time together today. I also have the great pleasure of introducing Wendy Quinn, who I've known since I started in bleeding disorders 12 years ago, as a parent first, before she did a lot of her advocacy work with Hemophilia Saskatchewan, and then with on the national front as well. So I'm so excited to be able to introduce Wendy, and I was laughing with her right before this because we're probably the only two people in the room who will have a hard time seeing over this podium, and we're the ones who get to start things off.
Thank you, Dr. SINHA. On behalf of the Canadian Hemophilia Society, it is a great honor to welcome you all to the Rendezvous 2023 in beautiful Niagara Falls. Let me take a moment to thank Hemophilia Ontario for welcoming us with open arms. In true rendezvous tradition, we come together as a patient organization and join forces with our 4 healthcare provider associations, the Association of the Hemophilia Clinical Directors of Canada, the Canadian Association of Nurses in Hemophilia Care, the Canadian Physiotherapists in Hemophilia Care, and the Canadian Social Workers in Hemophilia Care to deliver a program that will include the most up-to-date medical and scientific knowledge from our bleeding disorders experts, as well as hearing from each other through workshops and social gatherings. We also welcome our partners in the pharmaceutical industry, their contributions to the advancement of our care through their research and subsequent therapies is integral to our health outcomes as a bleeding disorder community. Rendezvous would not be possible without their support. So thank you to our presenting sponsor, Pfizer, our innovator sponsor, Novo Nordisk, our champion sponsors, CSL Behring, Roche, and Sanofi, and our supporting sponsors, Bayer and Takeda. So I'm going to go off script a little. Maybe about 10 to 15 years ago, there was a 10-year-old patient who was asked to be a part of an interview of the new pediatric hematologist that was being hired into our hemophilia treatment center. That 10-year-old patient is sitting somewhere over there, and that pediatric hematologist is sitting in the front here. And there was a very important intersection of medical professional and patient member. So that, in essence, is what we are here to do today, is bind us as a medical scientific group with our patient member. And what better relationship is there than that? If you were ever asked out there to go find the best evidence, here is where you come. Social media has so many things, but here's where you're going to find the real stuff. We are amongst the greatness here today in our medical profession, our researchers, our healthcare providers. So take that opportunity, have the courage, stand up, ask those questions, be inspired, and walk away with new knowledge. At this time, I would like to invite Dr. JANIE TRÉPANIER, Medical Affairs Lead, Rare Disease at Pfizer Canada, to come up and say a few words.
Thank you. Pfizer is really proud to be able to support this event where everyone gets together back in person. And we're really looking forward to this special day where we're all going to learn the latest medical and scientific evidence to see how we can all learn to better help people living with bleeding disorders live their best lives. So I'm really looking forward to today's event, and I hope you really enjoy this day. Thank you.
Okay, thank you. That was great introductions to the day. So today's rendezvous meeting, the title is New Beginnings in a Changing Landscape of Care and Treatment. And I think that's such an appropriate title because it really is a new beginning for care of many patients with bleeding disorders. There's been so many treatment advances and really exciting changes in our field. We are privileged to have an excellent lineup of speakers today. We're going to have a session on innovative coagulation therapies, a session on women with bleeding disorders, a session on mild hemophilia, and then to end the day, a session on gene therapy.
So what's a good day without objectives? So our objectives for today are to capture the future of bleeding disorder care and treatment, to better understand how innovative coagulation therapies and gene therapy will continue to change the hemophilia landscape, and bleeding disorders landscape, get a better understanding of how personalization will impact care and treatment, and of course, have a little bit of fun mixed in there.